servants to come together and join our MAGA Haga.
Okay, and we'll definitely have more on that later on. Let me just say, understatement, there's probably a few senators who got something to say about that.
Okay.
Yeah, but let's get Dr. Felix Cabrera. He's from the Governor's Physicians Advisory Group on the show. Good morning, Doctor.
Good morning, Chris. Good morning, Sabrina.
Half a day.
So we weren't really sure where to start. I guess just maybe where are we at as far as the testing? I know that the last 3 days we've only conducted 20 tests. Does this mean that we were kind of finishing up the limited priority group, Doctor?
For the most part, right now, you could say that. But the reality is that, I'm sorry, I'm getting an echo here. Do you mind if I call right back?
Sure. Maybe you can turn down your radio or.
Yeah, I don't have anything. Okay, there. Actually, echo's gone.
Okay,
Sorry.
good.
Okay.
Okay. So the priority testing group is for the most part caught up. But the harsh reality is that regardless of what's reported on a daily basis of how many positives there are on Guam, we have to understand the main caveat in these results, or in other words, the main underlying issue that you can't use it to necessarily relate to what the presence of COVID is on Guam, because we've limited the testing and we restricted the testing to priority groups. So, in other words, people who have symptoms that are consistent with COVID, but they're doing fairly well, when they call into the clinics, for example, or call into the hotline, they're advised to not come in to be tested if they're doing relatively well. So the number of positives we have is not reflective of what's actually in the community anymore. That was a very different case last week when we had those numbers, and they were fairly reflective, and that's what some of our graphs were using. But as soon as we made that restriction, we could no longer use that as a tool to correlate with what's the actual trajectory for the disease on the island.
Right, and it is a little confusing trying to explain to people that that's why we're seeing these lower numbers, is because we kind of said, you guys got together and said, hey, most vulnerable group is going to be the healthcare workers and elderly who are exhibiting symptoms of COVID-19, elderly who are in ICU or otherwise hospitalized. And so we understand that you guys were kind of going down and testing this priority group because they were the most likely to be the most vulnerable to COVID-19.
Correct. Yeah, and the reality is that the vulnerable group are not the main carriers on the island, and they're not the main spreaders of the disease. It's everyone else, and so that's why our common call is for everybody to assume that you have it and assume that everyone else has it, and to take the precautions necessary with that assumption, which could be a very, very real assumption. It doesn't second guess the decisions made from last week in terms of restricting the testing, because that was very important to treat the most sick. But the reality is that it gives a skewed view of what's happening on the island right now. Based on our current estimations, that we're probably about 3 weeks behind what we're seeing stateside. In particular, like New York, and so we're still in the very, very, very early stages of this war.
Right, Doc, and I just want to go back to what you said, is that people are seeing these results. Maybe they're not understanding that we're testing fewer people, but what they are seeing is fewer positives. And is it dangerous for people to assume that means that we're flattening the curve?
Yes, and so make no mistake that the efforts that everyone is doing is working. It's definitely working. It's helping. It's just still far, far, far from enough. And so it's definitely making an impact. We're seeing the curve, kind of make a dent, so to speak. But it's still far from enough for us to avoid the most catastrophic situations that we could be seeing in the next 1 to 4 months, actually.
So just to clarify, are we just running under the assumption that everybody has it, therefore we don't need to do a lot of tests, or do we just not have the number of tests that we need to go out and test, 200-300 people?
Yeah, our recommendations for testing are going to continue to evolve as we have the availability to test, and then our criteria will continue to change. Again, they're different point of attacks for how to use testing, and the advising the public that with the assumption that everybody has it and that you might have it is more for behavioral parts in terms of them complying with the governor's orders. But for the actual medical practice of testing and the decisions are made, that's going to continually evolve. We're working extremely diligently to open, to try and look at all these multiple avenues. We're talking about 10 to 20 different pathways. We're trying to get more testing on the island. But the reality is that every single state and every single county is going through the same thing throughout the country, and so we feel like we may be ahead in line in some of these pathways, but we still don't have a good timeline for when we'll get them.
Dr. Cabrera, I wanted to just follow up on whether or not there's a backlog of cases from people in the community that don't fit into the priority group.
I have not looked at their log in the past a couple of days. So they only ran one batch yesterday, as I understand.
And that was just for the priority group.
Yes, that was just for the priority group.
Okay, so there could be a backlog of swabs or tests from the community, because when people tell you and that they're all caught up, it seems disingenuous that it's not.
No, so I think so when they say they're all caught up, that is also including the medium risk groups as well, because those are they're the ones that are put in the queue. So when they're saying they're caught up, it's with that. But then the number of samples that they're receiving from the outside clinics, for example, have definitely reduced, because everyone's in a conservative mode right now in terms of even testing and sending, and so that's what we're seeing, and that's what's being reflected. So it's so we've been saying that some of these negative results that we get, they can be double-edged sword, in that they can be dangerous in that there's a few steps of assumptions that the disease is actually improving on the island overall, but it's still extremely way too early to make that call. It's extremely way too early to let up on any of the isolation and distancing and hand washing and covering your cough recommendations, and that we have to be, in fact, more vigilant about it, because again, we're like I mentioned earlier, we're about approximately anywhere about three weeks or so behind what we're seeing in other parts of the country.
Doc, where are we with the limited priority testing? Do you know? Are we just done with that now, and we're opening it up?
No. So that continues, and so what's the better marker for us right now is the amount of COVID positive patients that are admitted into the hospital. So those are real, because basically the real assumption is that whether or not you tested positive or negative prior to showing up at the emergency department, if you're sick enough because of COVID, you're going to show up, and then when you show up, you're definitely going to get tested, especially if you meet the criteria. And then if you're positive and you're admitted, that's to us a better trajectory of what's going to happen over the next time period. And so those are the numbers that we're looking at closely, and that's the models that we're using. It's still, again, an early stage, and the model has a wide range of variability, but it's something that is very scary, and it's something that we're looking at more. We're getting help with other sources to help corroborate some of the things that we're seeing, the numbers that we're seeing. But in the end, it's still our best assumption, our best estimates, and that's all it is. It's just like a super typhoon off that's down in a few thousand miles away, that we're trying to predict which path it's going to go. But the reality is that we could be hit very hard by a super typhoon like we've never seen before, and right now it's just sprinkling outside.
Are we seeing an increase in PUIs?
I think the overall number in PUIs is still around steady, but that's right now what we would expect.
What is that number?
Let me see here. I don't have those numbers right in front of me right now.
What is average or steady?
It's anywhere between, I think, about anywhere between 4 to 10 PUIs between both hospitals.
Wait, what do you mean between both hospitals? I thought only
because
GMH is a COVID designated hospital.
Correct. And so, but what happens is that patients do still show up at GRMC's emergency department, and then we because for a number of different factors, and then at that point they're determined to be somebody who should be a person under investigation, and but at the same time, because of the logistics of transferring patients back and forth between both hospitals, again, that's not as easy as said. They may be there for a period of time. They're still in isolation. They're still in the isolation rooms that are within the emergency department. But we do try and get them over to GMH as quickly as we can. But they still definitely become part of the count during that wait time.
Just for clarification, the PUIs, when they're brought over to GMH in isolation, if they're not part of the priority group, are they not tested?
Oh, they're absolutely part of the priority group.
Okay.
Doc, so part of the priority group is people who come into the emergency room exhibiting the COVID-19 symptoms, right?
Yes. Yes, hence being therefore being a PUI.
So wouldn't they not be a PUI if the test results are conducted? Right? Does that make sense?
So they're PUI until we get the results back.
Right.
And so
and then if they're negative, they're clear. If they're positive,
but they still would be at the hospital.
Yes, correct. And so they may be, but these are people who are determined that need to be admitted anyway, because of so they're they're sick because potentially because it's not COVID. The other thing that we're trying to investigate also is just whether or not no test is perfect, and there's a degree of false negative results and false positive results. We're pretty confident about when a test is positive that it truly is positive just because of the nature of this test. It's pretty good in that sense. But when a patient shows pretty classic signs and symptoms of COVID, and if the test turns out negative, we still assume that they have COVID, and we still treat them as they do, and we still work them up for everything else. The differential diagnosis is still not on the table. It could be another reason. They could have just regular COPD exacerbation or something like that. But the point is that we are taking extra precautions, and that we don't 100% rely on test results solely by themselves. And again, I'm mentioning this within the hospital setting.
Doc, what is going to be the next category of people that you guys are going to test when you're done with the limited priority group? Or is that something that you can be done with, or can they both run at the same time?
Yeah, and so it's really hard to say right now in terms of how that's going to develop until we better get a better sense over the next couple of days. Right now.
Is there any other information you could provide to the community? We had the governor on the show yesterday, and we asked about the U.S. Army Corps of Engineers and their offer to retrofit a facility on Guam. Do you have any other information on that? And then she also mentioned that she received an offer about a barge, a
hospital barge.
Yes, and so that's actually what with our state surgeon, Dr. Michael Cruz, who's who's leading this COVID task force, and we have our specific surgeon cell, and that's basically myself in there and Dr. Louis Cruz, who's a member of the Guard as well, and then other Guard members, and we're actively looking at all different aspects of readiness, for what's could potentially come over the next few weeks to next several months. And so part of that is a build up like that's been that's never been seen or even we've ever had imagined in terms of a number of beds that we would have to expand to.
Right. And the governor said that the goal is 2,000 beds.
Yes, and so of course we can't just build a 2,000 bed hospital over the next 2 to 4 weeks. So We're looking at other contingencies. There's a lot of different ways that we're looking at. Yes, this barge or a floating hospital, so to speak. It's something that could be converted. Something that we're looking at very seriously and making logistic plans for that. There are these type of pop-up tents, so to speak, that we're trying to procure so that would be part of this expansion. We're looking at different locations throughout the island as well. And so these, again, this is primarily for readiness, and that we're very much seeing what's going on. What's happening in New York, what's happening now in New Orleans, what's definitely happening very tragically in Italy and Spain, and now we're seeing more in France. And that we want to be sure that we do everything we can to mitigate that potential for us, and that we're ready if that tsunami hits us in that degree. But the reality is that right now, that's not our fate. We're not bound by that estimate and that trajectory, and everything we do right now in this very early phase could prevent a lot of that. And so that's why it's so important that everybody step up your game, so to speak, in terms of not just doing things for yourself, but keep your family accountable. Call them out, and so if they're not practicing what we're preaching and what we're trying to ask the whole public to do, then we need their help in terms of doing that. And so that's why it's so important to look at it from both aspects. And so we the medical community right now is we're trying to communicate with them about this readiness plan as well, and they've been good, but understanding why that there's this basically the operation from the guard in terms of readiness, and trying to be the main center that actually gets accounting for all the resources that's necessary to build up to at least 2,000 additional hospital beds.
But you can prepare for 2,000 hospital beds, right, and prepare these facilities. But what about personnel, medical people?
Yeah, and that's like the very next question that everybody asks, including us as well. That's a parallel process.
Mm-hmm.
Our very first priority, of course, is if we were to reach this nightmarish situation, that we got to figure out a place to put them, to put our patients, to start caring for them, and then at the same time now, that's why it's more important now than ever is that we look at all the medical professionals on island. Anybody who's been to medical school but doesn't have a license on a U.S. license to practice medicine that are here on Guam. Anybody who has nursing training, EMT training, who's been a medic in the past. Those are all things that we're trying to get a good inventory of right now, and that these emergency allowances will take place if necessary to give them the ability to help in this war. And so this is very serious, and we're taking it extremely seriously. And we pray to God that we're wrong, and that this is just going to be a great exercise overall. And it's something that we should exercise anyway. How there's war games. This is I hope that this is just germ games. And that we're practicing. Bill Gates is the one who coined that term.
Yeah.
And so we hope that that's the most of what this is. But readiness is key, and readiness will save lives.
Doctor, I want to ask you. You gave that presentation. You raised a lot of eyebrows. Very alarming presentation. The numbers we've seen after that don't necessarily match up with what you said. So how important is it for people to take what you said in that presentation seriously? And do you still stand by what you told the people of Guam?
Absolutely. And so what the analogy that I've been using, so the presentation from last week was a way to address the first grenade that was thrown at us, okay, and how to dodge that grenade, how to get away from it, and so that we are not hit by the first attack. And so that's what the graphs that were used was all about, trying to understand what was the actual threat and how to get away from it and how to suppress it. But right now, so to all of Guam's credit, we avoided that first grenade. And I think that that's extremely important. Now, in the process, we still did lose, one life, and that's a very valuable life, and every life matters. But in the grand scheme of things, we did avoid that very first grenade. Now we're talking about the entire war. And now we're looking at numbers to try and it's like trying to predict any war's numbers. There's a large degree of variability, but that's the numbers that we're looking at now in the trajectory. So I definitely stand by the numbers from last week. It's just that now it's a different. Now we're looking at a whole different part of the of this war with COVID.
I wanted to follow up on what's happening over at the quarantine facilities, because we received confirmation that I believe it was on Sunday, there was an individual who was displaying flu-like symptoms and was transported to GMH and is there as a PUI. How concerning is that to you?
That's the first I'm hearing specifically about that. And in terms of the, because I don't know what their status is right now. I don't know what what it is, but that's the though if you just think about the pure odds, that's why quarantine is important. Is that we would expect one or two people to potentially start showing symptoms and maybe more, and that's why quarantine is so important.
Okay.
Okay, Doc. I know we said 5 to 10 minutes.
But
45 minutes ago.
But
no, there was something else.
If you don't mind, I just like to make a couple of pleas out, and I think these are important tips that I picked up recently. We talked again about what's going to be the big flood to this that could potentially surge our hospital and our healthcare system. Just a reminder that there's about in terms of how many persons above 65 years old or above on Guam, that's about 8.9% of our population, or over 15,000 people. So just that by itself, there's over 800 dialysis patients here on island. If they all got sick at the same time, you can imagine what kind of horrific scene that might be. And so we absolutely want to avoid that. But so that's why, again, protecting them is very important. But I want to give some very specific tips, if that's okay, about protecting the vulnerable within your own household. And some of those are things that we don't think about as well. Like they should sleep in a different part of the house in a well-ventilated room. If possible, you have them use a separate bathroom. And reduce the number of people in the house. Don't have visitors. Air out the house when possible. Obviously, wearing a mask is important as well. Do their laundry separately. Don't share objects like a phone. And if you do use a phone, speakerphone is the best option. Clean the surfaces at least daily. Clean your phones as well, of course. Remotes, light switches, doorknobs, those are important. And then, of course, touching your face it's built into our DNA. Babies in utero touch their face, and we use it as a soothing mechanism. But ironically, during these stressful times, it's even harder to avoid doing that. But there are things that we can do to remind ourselves not to do that. So one of the things I've been saying is pretend like you have a electric fence around your shoulder, and that if you put your hands above your shoulder, it's going to shock your hands. And so if you just kind of imagine that and how important that is, that might help be a reminder. If you wear a mask, that sometimes is a reminder also to not touch your face. Don't eat with your hands is another thing. But those are some of the tips that I wanted to just throw out there, because just these simple things can really make a big difference and can really help save lives.
Doc, I'm sorry. I do have one more question, and I wanted to ask about the situation over in Saipan, because I know you are from there. And what sort of communications have you had with the task force over there?
Yeah, and so particularly my main communication as of recent is with Dr. John Tadella, who's the medical director and the chief medical officer for the hospital there, and he was in fact the main physician caring for the patient who recently passed. And it's tough, and the first death is always very, very tough for the entire community. And so, he's right now. I think he himself and the rest of the staff there, need the community support. The whole community needs to support the family of the deceased, but I think that they're doing a lot of right things right now. They've instituted a mandatory curfew for the entire island. I think that's what I keep saying is that there hasn't been, even Dr. Thane Hancock has been saying this as well, is that there has yet to be a country on this planet that has over-prepared for COVID. And I think that's a very, very powerful statement. And so I don't think there's anything we can do to be over-prepared for this. And I applaud the CNMI for taking the efforts they are right now. They took it very, very early, and thankfully their timeline is further behind, I think, the rest of the globe. We're also lucky that our timeline is behind, the rest of the in the United States and countries like Italy. And so we have to be grateful for that and learn from their lessons and continue to be more and more prepared.
All right. Well, thank you so much, Doc, for calling in. We really appreciate your time. And
I really appreciate you guys' effort. You guys are a major part of this battle, and keep doing what you're doing. You guys your messages and your strength is important. I know that this has been tough on all of you as well, and it's been wearing down. But I really appreciate the messages of appreciation from the community. Trust me, that really goes a long way. It makes me bounce out of bed and want to get to work right away. And so those are very important, and I can't thank the community enough for that.
Okay, thank you,
Thanks,
Dr.
Doc.
Cabrera.
All right, thank you. Have a great day.
You
Take
too.
care.
Wash your hands. 6:54. Hey, we got to take a break, and I believe we're getting Linda DeNorsi from the Department of Public Health and Social Services. Coming up, we'll do news. We're KUM FM Magatni, Guam, containing COVID Tuesday, the 30th.